Welcome to another lecture by MedicoMedics, Pharmacology Chapter 2, Pharmacokinetics. In this lecture, we will talk about pharmacokinetics, discuss concepts like absorption, distribution, metabolism, excretion. We will take a look at pharmacokinetics in action and look at an example using ibuprofen. And then we will end with a summary. So pharmacokinetics is the study of how a drug moves through the body, often described as ADME. And the diagram here summarizes the four key phases of pharmacokinetics, known as ADME. So we have absorption, distribution, metabolism, and excretion. Together, these processes describe how a drug moves through the body from the moment it enters to the point it's eliminated. And understanding ADME is essential for predicting drug onset, intensity, duration, and safety in clinical use. So the diagram here illustrates the first step, which was absorption, which was the process by which a drug enters the blood from its site of administration. Now, after, for example, oral administration, the drug travels through the gastrointestinal tract and must cross several biological barriers before it reaches systemic circulation. Now, the path begins in the gut lumen, where the drug dissolves in GI fluids. It then passes through the intestinal epithelial cells via processes of passive diffusion or active transport. And this is often the rate-limiting step. Now, once inside the intestinal wall, the drug enters the portal vein and is then transported to our liver. In the liver, a portion of the drug may be metabolized, a phenomenon known as first-pass metabolism, which reduces the amount that reaches our systemic circulation. Now, the fraction that remains active is what's called the drug's bioavailability. So the factors affecting absorption include the drug's formulation, its solubility, pH stability, surface area of absorption, and of course presence of food or other drugs. And understanding absorption is crucial for selecting the correct route, dose, and timing of the medication. Now, once the drug has been absorbed, how does it then travel to its destination? So let's go and explore distribution. Now, after absorption, the drug enters the bloodstream and begins the process of distribution, meaning its dispersion into tissues and organs. Now, this will depend on several key factors. First one is blood flow. So organs with high perfusion, like the liver and the brain, receive more drug more quickly. And the reason for that is because they have a rich vascular supply that delivers large volumes of blood per minute. Second one is plasma protein binding. So only the free, unbound drug can leave the bloodstream and exert an effect. Drugs that are bound to proteins like albumin, for example, they will remain inactive. Finally, tissue permeability. So lipid-soluble drugs can easily cross cell membranes, while water-soluble ones may be restricted. And a special consideration here is, for example, the blood-brain barrier, which protects the brain by limiting the entry of many drugs, making the central nervous system penetration more difficult unless the drug is specifically designed to pass through. And we have a whole dedicated lecture on different barriers, including the blood-brain barrier. Make sure you check that out. Now, once the drug reaches its site, it may need to undergo changes, and this is what brings us to metabolism. Now, metabolism refers to the chemical modification of drugs, usually occurring in the liver. and it is to make them easier to eliminate from the body. Now, it happens in two main phases. Phase 1 involves modification reactions like oxidation, reduction, or hydrolysis, which introduce or expose functional groups. These reactions are primarily carried out by cytochrome P450 enzyme system, often abbreviated as CIP enzymes. Now, phase 2 is conjugation, where the drug is joined with a water-soluble molecule, like glucuronic acid, for example, making it easier to excrete through urine or bile. Now, an important concept here is the first pass effect. So, drugs taken orally must pass through the liver before entering the bloodstream, and a significant portion may be inactivated during this first pass, leading to a reduction in its bioavailability. Now, after metabolism, the body needs to get rid of the drug, so let's look at excretion. And now we arrive at the final phase of pharmacokinetics, excretion, the process by which drugs and their metabolites are removed from the body. Now, the kidneys are the primary route of elimination, especially for water-soluble drugs. These are filtered into our urine. Then we have the liver. So the liver also plays a role by excreting some lipid-soluble drugs into bile, which are then eliminated in feces. Other less common pathways include the lungs, for example, for volatile drugs like anesthetic gases, as well as sweat and saliva are some of the other routes here. Now, a key concept in relation to excretion is the concept clearance. It refers to the rate at which a drug is removed from the body. It directly impacts the drug's half-life and helps determine the appropriate dosing frequency to maintain therapeutic levels. Now, what is half-life? Let's move to pharmacokinetics in action and see what it is. Now, to finish, let's apply pharmacokinetics to real-world prescribing. Two key concepts here are half-life and steady state. Now, a drug's half-life is the time it takes for its concentration in the blood to drop by half. This directly determines how often we need to give a dose. The steady state concentration is reached when the rate of drug intake equals the rate of elimination. So it's a critical concept in long-term therapies where stable blood levels are needed. For example, drugs with a short half-life, like paracetamol, requires more frequent dosing, while those with a long half-life, like amiodarone, can be given just once daily. Understanding this helps tailor dosing regimens to maximize effectiveness and minimize toxicity. Now, let's summarize all 4 key steps in pharmacokinetics using the drug ibuprofen as our example. So at the very start, after swallowing, ibuprofen dissolves in the stomach, mostly absorbed in the small intestine. Now from there, it enters our bloodstream through the portal vein. So it's been absorbed now. Then we have distribution. So once in circulation, ibuprofen is extensively bound to plasma proteins like albumin. And then it is distributed to inflamed tissues, joints, and muscles. Afterwards, in the liver, ibuprofen undergoes phase 1 oxidation via the P450 system, mainly CYP2C9. This will convert it into inactive metabolites. These metabolites then are conjugated in phase 2, making them water-soluble. And so now the water-soluble metabolites are then primarily excreted by the kidneys in urine. Now, because ibuprofen has a relatively short half-life, approximately 2 hours, it needs to be taken multiple times a day to maintain its effect. So in summary then, we discussed the concept of absorption, the entry into our blood, distribution, the delivery to our tissues, metabolism, the transformation in the liver, and finally excretion, so the elimination via our kidneys or bile. Why is all of this clinically relevant? Because it helps us optimize dosage, avoiding toxicity, and ensuring effectiveness. Next, we will explore pharmacodynamics to understand how drugs produce their effects. And that's the end of the lecture. Please continue to Chapter 3.